Time series. Before we are about to see a question, I would like to explain a few things. Here we can see the developing stomach, and it is the anterior abdominal wall, and it is a posterior abdominal wall. This is the fold of peritoneum that is suspending the stomach from the anterior abdominal wall. So it is called as ventral mesogastrium. And this is the fold of peritoneum attaching the stomach to the posterior abdominal wall, and it is called as dorsal mesogastrium. Okay, so the stomach rotates 90 degrees clockwise. The stomach rotates 90 degrees clockwise. So what happens is the the ventral mesogastrium comes to lie in the right side, and the dorsal mesogastrium comes to lie in the left side. Within the ventral mesogastrium, there is a developing liver, and within the dorsal mesogastrium, there is a developing spleen. Okay, so between the anterior abdominal wall and the liver, we have the fold of peritoneum called as falciform ligament. Between the liver and the stomach, we have the fold of peritoneum, lesser omentum, both of which are derivatives of ventral mesogastrium. This you must know. Okay, both of which are derivative of ventral mesogastrium. Now looking on to the next picture, here we can see the adult falciform ligament that is suspending the liver, that is attaching the anterior superior surface of the liver to the anterior abdominal wall till the umbilicus, till the level of umbilicus, and also to the diaphragm. So this is your falciform ligament, and this is your free edge of the falciform ligament. Okay, you can say it as inferior edge of the falciform ligament, or you can say it as a free edge of the falciform ligament, which has a rounded structure, called as the ligamentum teres. Okay, which has a rounded structure called as the ligamentum teres, otherwise called as the round ligament of the liver, because we have one another round ligament of the uterus. So the ligamentum teres of the liver is called as the round ligament of the liver. What does it have? The ligamentum teres, what does it have? Okay, the falciform ligament, the free edge of the falciform ligament has ligamentum teres, otherwise called as the round ligament of the liver. You have to be more specific because there is round ligament of the uterus also. So what does the round ligament of the liver has? What does the ligamentum teres has? Okay, it has the obliterated left umbilical vein. Okay, obliterated left umbilical vein. Okay, what happens to the right umbilical vein? Right umbilical vein disappears. Only the left umbilical vein persists. And this left umbilical vein, after the birth of the baby, it gets obliterated, and that you can see as a round ligament of the liver. As you all know, an umbilical cord has two arteries and one vein. You have the right and the left umbilical artery, but you have only the left umbilical vein that also gets obliterated after the birth of the baby. So the answer to this question is ligamentum teres. The falciform ligament contains ligamentum teres. So you can see the cadaveric liver here, the anterior surface, which has the sickle-shaped fold of peritoneum. You can see it like that of a sickle. It is sickle-shaped fold of peritoneum that is called as a falciform ligament. Here you can see the posterior surface of the liver, and this is here fissure for ligamentum teres. Here you can see the rounded structure, ligamentum teres, and fissure for the ligamentum teres you can see here. Okay, so what does a ligamentum teres contain? The ligamentum teres contains the obliterated left umbilical vein, and also a few para-umbilical veins. Also a few para-umbilical veins. This obliterated left umbilical vein and the para-umbilical vein drains into, here you can see it is the left branch of the portal vein. This is the portal vein and this is the right branch of the portal vein and this is the left branch of the portal vein. This two structures that are in the ligamentum teres, that is the obliterated left umbilical vein and the para-umbilical veins drains into the left branch of the portal vein. So they are tributaries of the portal vein. And here you can see the para-umbilical veins, which are tributaries of the portal vein, having communication with the anastomosis with the superficial veins of the anterior abdominal wall in the umbilicus. At the site of the umbilicus, the para-umbilical veins are anastomosing with the superficial veins of the anterior abdominal wall at the site of the umbilicus. So, umbilicus is a site of portosystemic anastomosis. Portosystemic anastomosis. So, what happens when there is a portal hypertension? When there is a portal hypertension, the para-umbilical veins cannot drain into the portal vein. It is getting blocked, cannot drain into the portal vein, and they depend on the superficial veins of the anterior abdominal wall. They depend on the superficial veins of the anterior abdominal wall for drainage. So what happens? There is dilation of the superficial veins of the anterior abdominal wall in conditions of portal hypertension, and that we call it as caput medusae. Okay. So, another question related to this is during the first 5 to 7 days of life, the umbilical vein can be catheterized and can be used for central venous pressure monitoring. The umbilical vein leads to which of the following vessels? See, the I said the umbilical vein gets obliterated after birth, but it collapses after birth, but anatomically it closes after 7 days. So within the 7 days, it can be used for emergency purposes for infusion of the baby or can be used for central venous pressure monitoring of the baby. So here you can see the baby has been catheterized into the umbilical vein. So what happens? This umbilical vein will be here. You have the portal vein and you have the right branch and left branch of the portal vein. So the umbilical vein drains into the left branch of the portal vein and the left branch of portal vein has communication with the inferior vena cava through ductus venosus. Ductus venosus, it has communication with the main vessel, inferior vena cava. So, the umbilical vein leads to which one of the following vessels? It leads into ductus venosus. Okay, so that is the answer here. Um, so we have one another ligamentum teres. So find out where else we can find ligamentum teres. Thank you.